Hello, my name's Joe and I've been diagnosed with prostate cancer, which has sadly spread. What I'd like to do in this video is talk about the precursors to me being diagnosed, and for you not to follow my footsteps, and to talk about the treatment that I'm getting, and then hopefully if you want to watch a further video I will post it. Before I actually go into it, I'll just warn you that I'm not going to be necessarily PC. I might swear, it's just me, and I'm not going to necessarily be using medical terms. I might try and instill a little bit of humour, because situations like this you can either laugh or cry. So, years and years ago I was starting to get the symptoms. Weak stream, not emptying the bladder, frequent visits to the bathroom at night, and I just put it down that I'm getting a little bit old. In 2019, I think it was, my PSA level was 2.9. Now, every year I go to the doctor's surgery because I've got an underactive thyroid, so I'm on medication for that. And so I'm getting an MOT every year. Every time I went to get one during COVID, I used to say, any chance of a PSA test? And the answer was, well, there's nothing on your notes. If you're that concerned, then obviously go and speak to the doctor. Getting doctor's appointments during that time was like rocking or shit, and also I was very lazy, I couldn't be bothered. I just thought, once again, oh, it's just an enlarged prostate because I'm getting old. I mean, I was 66, I was over 60, and so these things happen. So I think it was January this year, 2023, a good friend of mine told me that he'd been diagnosed with prostate cancer and he was getting treated for it. And he said, Joe, you make sure that you get checked out. So in February of 23, I got checked out on the back end of getting a thyroid check. And the result came back, it was 13.6, so my heart sank. Don't do what I did. If you get those symptoms, get checked out. 2 weeks after the result came through, I was having an MRI scan. The MRI scan showed that I had a prostate, which was 52 cc. Now, the prostate does age as you get older. For someone of my age, it should be between 24 and maybe 38 cc. Obviously, mine was a lot larger than that. But what they also said was that there was a suspicious area within the gland itself, and there was something else to the left of the gland, but it was slightly degraded because of the image due to my hip replacement. And I just want to show you this. Okay, this is nothing to do with my prostate cancer, but you can see from this image here, we've got the hip replacement, both of them. But what I want to show you is this thing right in the center here. When I first saw it, I was in shock. Looks like a pig to me. I must have had too much bacon that day. So the next course of action was to have a biopsy of the prostate. So on the day of the biopsy, I'm in my gown with your ass hanging out. You go into this little waiting room, and there was a guy in there, and I was sort of talking to him, what was your PSA, blah, 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 and how was it? He was waiting there because he just had his biopsy, and you have to stay there for about 50 minutes to an hour before you can actually leave, and you have to pass have a piss before you actually go home. So I was chatting to him about it, and I was saying, how was it? And he goes, yeah, it wasn't too bad. Another guy then came in who'd just had his biopsy. How was it? Yeah, it was okay. Then it was my turn. In I go. A nurse takes me into the this little room, and there's a doctor there, or the guy who's going to do the biopsy. There's a woman there with a clipboard. She's going to be doing a survey, which I actually volunteered, that I would do that. And there was another woman there as well. Really small room, and that other woman could have been the cleaner for all I know. And a little bit nervous, and I said, hey, there's more people in the waiting room if you want to bring them in as well. It was just my way of hiding my nervousness. And so I was put on this bed, my bollocks were taped back, one leg up here, one leg up there, my arsehole facing all the women, like, nice. Then I got the good news. I'm going to get a DRE, a digital rectal examination. Now, I did my very best to try and talk him out of it. I says, look, the scan says it's enlarged, but there was no way he was having it. His finger was going up my bum. Now, I remember having one of these about, I don't know, it must have been about 18 years ago or something like that, maybe even longer. But this guy was like an Asian doctor. He had nice, slender fingers. This guy was like Banana Man. So in he went, and I'm like screaming, shit, you know, I'm swearing, Jesus, but Christ. Couldn't help it, like, it was painful. And when he finished, I said, is it enlarged? He went, yeah. And I thought, well, the MRI scan told us that. I mean, if he'd take me for a drink or dinner or a bit of foreplay beforehand, it might have been a bit easier for me. But no, it was wham, bam, thank you, ma'am. And to this day, you know, he's not texted me, he's not sent a birthday card. Anyway, enough about that. The next thing was the actual biopsy. So have a quick look at this image. So there I am on this bed now, legs up. In goes this probe up the bum. The bum was sore enough from his finger up there in the first place. Now the probes themselves, they weren't too bad. As they went in, it was just like a little electric shock as they extracted the bits of the prostate. But I'm not kidding you, I couldn't wait for it to be over. And finally it was. Now I had 15 probes altogether. And my mate, he told me they had 21 probes. So I said to the doctor, I said, look, if you ever see him again, tell him I had 30, because I couldn't be beaten by him. So anyway, the torture was now over. And I'm so glad that there was no one in the waiting room waiting to go in when I went out, because I'd have given the Bobby Moore. Jesus Christ, I hated it. So you have to sit in there for about, I don't know, must be about 50 minutes to the hour, I think it was. And then you have a pee, and that was the weakest stream that I'd ever encountered, and obviously there was blood in it as well. So when the nurse said it's time for you to go, I did say to her, I says, how did I compare to other patients? Was I a bit of a pussy? She went, yep. And I think I made some stupid comment like, Jesus, if I was gay, I'd be a giver, not a taker. Anyway, that night I went home trying to watch TV. And there's no way I could sit on my bum. I had to actually lie on my side. My ringer was so sore. And I was thinking to myself on reflection, you know, I'd rather do the commando test week again than go through that. Now you will find that you'll have blood in your urine when you go to the bathroom, and they say it could last about 1, maybe even 2 weeks. In my case, it only lasted 2 days, so that was good. With regards sex, there's definitely going to be blood in your jizz, and that'll be there for a period of time. So I would recommend no blowjobs, a few 5-finger shuffles, clear yourself out, or wear a condom. Now 9 weeks have passed since my initial blood test when I was hitting 13.6, and the biopsy results reveal that I've got cancer of the prostate with a Gleeson score of 4+3, obviously a total of 7. But there was also some suspicious activity in the lymph node to the left of the gland. Before I go any further, I'll just explain in layman terms about the Gleeson score. Okay, I'm not sure whether you can actually see this. Unfortunately, my video software doesn't allow me to talk over a picture that I might put on the screen, but you can see here we've got the Gleeson score running down this side, and then we got our normal, what we're used to, grades 1 to 5, obviously 5 being the most serious form of cancer. So if I was a 4-3, you can see I'm grade 3. The cells look less like normal prostate cells, and the cancer is likely to grow at a moderate rate. Okay, whereas if I was a 7 with a 3-4, most cells look similar to normal prostate cells. The cancer is likely to grow slowly. So I'm in the intermediate group, right in the middle, smack in the middle of 1 to 5. I was then told that I'd need a PET scan, very similar to an MRI scan, and that would be my next course of action, and that way they could identify the exact location and to see if there was any spread. Obviously, I was worried about the lymphatic system. Okay, the PET scan procedure, pretty quick and easy really, apart from the waiting. You go to the hospital, you go into this room, and they inject you with a radioactive tracer into the vein, and the whole idea is it's going to circulate around the body. So when they do the scan, those radioactive traces will actually cling to the prostate cancer cells. The actual PET scan itself, like I said, similar to an MRI. You just lay there and the actual scan takes about 30 minutes. That was it. So apart from the waiting to go in, it was over within about an hour and a half. Easy. Okay, so it's now June. Bearing in mind it was February when I initially got my PSA. And so as you can see here, ignore all this here. I've been told that's nothing to do with it. But you can see down in the prostate area here, hopefully you can see it on the screen. There's a marker there, and as they said, in the prostate itself, in the gland, but also to the left of the gland on the left lymph node. So that's that particular view. And this is another view, obviously looking from the floor up. And you can see once again, there's the one in the prostate and the one in the area of the lymph node. Also, I was told by the consultant that it had spread. And as you can see, prostate, lymphatic system. And what he said, this is a pretty unusual case because it's going up through your lymphatic system and it seems to stop there and then appears up in here in the lymph node on the left side of the neck. Once again, ignore all these dark patches here. Apparently that's normal. I mean, looking at that, I can't read it, but they're the experts. But you can see it clearly moving up through the lymphatic system. Then there's a gap, and that's why he said it was unusual. I don't know what all this is on the other side. So the next course of action is a biopsy of that lymph node there. They also said that it is spread to the seminal vesicles. I call these jizz bags. Basically, these vesicles here, they contain most of the fluid that you would actually ejaculate. Obviously, some comes from your ball bag, but you've got your jizz bag here, so that might account for the decrease of volume of semen or jizz that I've had over the years. So prostate, lymphatic system, and my jizz bags. We were then taken away by a nurse, taken to this room, and she basically explained the next course of action, which was, to start hormone therapy whilst waiting for the next biopsy. I was told to go on to bicalutamide, 50 mgs, for a period of 28 days. This would be then followed ASAP with a Prostate 3CS 11.25 mg injection, which would take place every 3 months, or it could be monthly. It all depends on what the supplies they've got. The aim of this is to reduce my testosterone levels. As we know, prostate cancer cells are fueled by testosterone. So the aim is to lower my testosterone, which will hopefully have a knock-on effect and lower my PSA. And as I said, this is going to be administered every 3 months. And apparently the reason you've got to take this bicalutamide is that when you get your prostate jab for the first time, you're going to get a surge in testosterone. Well, I thought that's not a bad thing. It means I could be a rampant rhino for a few days, but apparently you've got to take this to counter the side effects. Now, there will be side effects with taking hormone therapy, and if you want me to publish another video, I'll go into those and actually how the hormone therapy is reacting to my body. I must admit, the nurse was very, very supportive. Everyone's been very supportive throughout. I was given literature with helpline numbers, etc. So we left the hospital, me and Fiona, and I was so glad that she was there with me. We got back to the motor, and I remember sitting in the driver's seat and just simply going, hands on the wheel. I just dropped my head and I just broke down. But what can you do? It was just a shock. What started as what I thought might be just an enlarged prostate wasn't. What then was hopefully just confined to the prostate wasn't. It's spreading. So typical. straight in at the deep end. So don't do what I did, get a PSA check. Definitely. So that's my story so far. I will keep you updated if you want, and I'd love you to share and post some comments to keep us all updated, your experiences, etc., how we can help one another. But thank you for watching, and I will publish my next one with some updates at a later time. So until my next video, thanks for watching. Please subscribe if you can. Don't be lazy like me. Get checked out. Bye for now.